And we are live. It's Dr. J here. We got a live Q&A session. It's supposed to be a podcast, but we're being flexible on this Labor Day Monday here. So hope everyone's enjoying their long weekends. We're going to talk about thyroid and TSH testing. This is a common issue that I deal with in my clinic. Is a lot of people come in with thyroid issues or imbalances, and they have this TSH test, which is a thyroid-stimulating hormone test or a thyrotropin test, and they're utilizing this test to help assess their thyroid function. So you get people coming in with maybe low thyroid symptoms, right? This may include cold hands, cold feet, hair loss, outer third thinning of the eyebrows. They may even have constipation. They may have anxiety, depression. They may even have dry skin as well. And they're kind of like overturning all these clinical rocks, so to speak, of what could be the underlying issue of why I have these symptoms. And thyroid's one of those things that people look long enough on the internet, on Google, on different blogs. It's one of these hot topics that are out there just because, number one, it's so common. About 1 out of 5, I'd say about 20% of women out there have some sort of a thyroid imbalance. So it's pretty common. And outside of the thyroid, there's an intimate connection with thyroid issues and adrenal issues. So this is pretty unique because a lot of times you can have a thyroid issue and an adrenal issue at the same time. It's not either or, it can be both. So some people, it's exclusively a thyroid issue that's now blended into an adrenal issue. Let's say there's Hashimoto's and inflammation, and that inflammation is caused by gluten issues and by dysbiosis and leaky gut and maybe toxicity and maybe poor diet and blood sugar. Well, that will eventually start creating problems with the adrenals. So blood sugar regulation, inability to regulate inflammation via cortisol and glucocorticosteroids. Eventually, it'll put a lot of stress on the adrenals, thus affecting sex hormone output, DHEA sulfate. If you're a female, the more inflammation that's going on, the more that's going to throw your progesterone into cortisol, because your body's always hardwired to deal with inflammation over sex hormones. And sex hormones, what that means is hormones that help reproducing you, your cells, your hair, your skin, your muscles, your bones, right? Anabolic physiology building up, but also fertility. So fertility isn't, when we think sex hormones, it's not just about having a baby, right? You could be younger, you could be older, and really it's about growing your body and healing and recovering. And part of being fertile is being healthy. So if you're not fertile, at the underlying, there's some level of dysfunction going on with your health. So let's kind of dive back into my original topic, which is the TSH testing. So that's thyrotropin or thyroid stimulating hormone. That's a brain hormone. So we have our brain up here, right? We have our hypothalamus and our pituitary. So the pituitary here is where we talk about TSH. Now, if we go one level above that, we have what's called TRH, which is thyroid releasing hormone, and that comes from the hypothalamus. Again, we really don't see much of that in clinical application, primarily only in universities for research. So it's not a test that we can look at to assess thyroid function. So it's one of these things that we keep in mind, but it's not really clinically applicable. But one of the things above TSH that's really important for TRH signaling TSH is dopamine. And dopamine and adrenaline are intimately connected because dopamine is actually a precursor to adrenaline. So the more stressed we become, the more we're actually going to pull from our dopamine into adrenaline, right? So we can throw off that balance of healthy dopamine levels, which are really important for focus. It's that I love you neurotransmitter. It's one of those neurotransmitters that we get stimulated and produced when we're in that feeling of euphoria called love. So we have the TRH, which is really not applicable for us, but it's something I want you to keep in mind. The second domino is TSH, which is the pituitary. That's thyroid stimulating hormone. So it's actually not a thyroid hormone. That's the key thing I want you to zone in on. It's actually a brain hormone. And this is key because brain hormones aren't thyroid hormone. They help talk to the thyroid and help the thyroid make hormones. So a lot of people, when they're told that they have a thyroid issue, many times they're really being told that they have a pituitary issue. All right. So really, they're being told it's a thyroid issue, but it's really a pituitary issue. Now, it may mean it's a thyroid issue. It probably does. Actually, the bigger issue with TSH, it's too late stage. A lot of people have normal TSH, but they have downstream thyroid issues regarding T4 and T3. So typically, if TSH is high, right, or extremely low, right? Our reference range is 0.5 to 4.5. That's our standard range. My standard range is about 0.5 to about 2 to 2.5 is like kind of my sweet spot range. Anything above 3, I kind of make a note on. But again, if we earn that sweet spot range, we may be okay, but we got to look downstream at T4, free in total, and we got to look downstream at T3, free in total. So TSH is a really good broad indicator of what's happening. Again, it could be normal, but downstream, the T4 and T3 issues are present. So first step is, if TSH is normal, we then have to look downstream, T4 free in total, T3 free in total. If TSH isn't in good shape, if it's excessively high or excessively low, well, guess what? We still have to look downstream at T4 free in total. And we also have to look at the antibodies, because autoimmune issues, whether we have TPO, thyroid peroxidase antibodies, whether we have thyroglobulin antibodies, these antibodies can affect how our glands being attacked. So typically TPO is more of an intercellular attack on the enzyme that makes thyroid hormone, and thyroglobulin antibodies are that extracellular protein structure of the thyroid. So we can see as we attack that thyroid, our immune system, as those B cells come in and those lymphocytes come in and attack that thyroid, hormone can spill up, and eventually it can actually run dry a bit, because you only can hold about 3 to 4 months of thyroid hormone in your follicles. So over time, you can create abnormalities, typically high levels of thyroid hormone, which drop down your TSH. Okay. So the better someone can hear you, the more you whisper. The more someone can't hear you, the more you raise your voice. So think of TSH as raising the volume, when thyroid is low, and it's whispering when someone's super sensitive, maybe has a migraine headache, and now you're whispering because they're so super sensitive. So think of it as an inverse hormone. Low equals high, high equals low. So when we start to see issues with TSH, we want to think, is there an autoimmune issue? That's number one. Number two, are there adrenal and stress and inflammation issues? Because that can throw it off. Number two, and then number three, of course, is going to be toxicity, which kind of equals stress as well. But then we got to look downstream to the T4 free in total. Now, free is going to be your 2%, 2 to 5% of your hormones going to be free. So that's going to be not bound by a protein, so it can start binding to receptor sites. And then the total is going to be basically everything else, or the free and the 95 to 98% that's protein bounded, right? 95 to 98% has a protein bound to it. The other 2 to 5% is free, so it can actually bind to a receptor site. So the total gives us a kind of a window into what the glandular output is, and the free gives us an input into what's actually biologically available to bind to a receptor site. It's nice to look at both. And then the other piece that we're not kind of getting here is the T4 to T3 conversion aspect, because we have to see, are we actually converting T4 to T3 downstream? A lot of people, let's say you're at 1.2 or 1.3 on your T4 free, which is a good number, but you may drop down to like 2.2 on your T3 free. So you may be like right in the middle to upper 25% of the range for T4, but then we may see it drop off down here for T3 free. So we want to look at that, because there's lots of things that can affect conversion, like insulin, high or low levels of insulin, cortisol levels, certain nutrients like selenium, vitamin A, copper, zinc, magnesium, also things like mercury, low protein levels, digestive issues, dysbiosis, liver toxicity. So a lot of things can affect thyroid conversion, so we want to look at it. So recap, we have TSH, that's the domino. The first, actually, we have TRH. That's the first domino, but it's not clinically applicable. So the first official domino is TSH. Then we have T4, and we break it up into free and total, right? Free is the 2 to 5%. Total is the whole glandular output. Then we have the conversion aspect from T4 to T3, which is what's commonly overlooked. Even a good endocrinologist will typically run TSH and T4, and that's it. Very rarely see it. So we got to run TSH, T4 free in total, T3 free in total, look at this conversion aspect. And then we even want to look at reverse T3, which is the metabolic brakes, so to speak, to help slow things down, and then even the antibodies. So I'm going to open it up to some questions here. We'll kind of run it, try to keep all your questions pertinent on the topic. If it's not, I'll just skip it and go to the next. All right. So off the back here, See here, someone talks about vitamin D deficiency. I'll relate it to thyroid issues, but vitamin D is important because it helps modulate the immune system. It helps what's called the T regulatory cells in the immune system, which have an effect on the TH1 and TH2 immune system. So imagine you got a seesaw, right? You have one side of the seesaw, let's call it TH1. The other side of the seesaw is TH2. And imagine you got one person on the other side who's 100 pounds, the other person's 200 pounds. Well, of course, there's going to be a mismatch, right? The person that's 200 pounds will keep the seesaw down, and the person that's half the weight will be up here. Think of that as an immune imbalance, okay? So we want ideally to get people on the seesaw that have parity in their weight so we can keep that seesaw level. So when your immune system's out of balance, well, vitamin D is an important balancer of that immune system. So usually 50 to 70 on your United States vitamin D scale is ideal. And again, there's other things that can affect it like blood sugar and immune issues and infections, but that's an important marker is vitamin D for that. So Monica writes here, TSH is at 0.01. So a couple things. Number one, there could be like an autoimmune issue like Graves going on. If there is Graves, we want to look at TSH receptor antibodies. We want to look at TSI or thyroid-stimulating immunoglobulin, because that can be an important factor of Graves. Also, just looking at your T4 and your T3 levels. If your T3 levels are very high, you're in the upper 4 or above for T3 free, or your T3 totals, into the upper 100s, then we have some problems, and we'd have to look at getting the immune attack dialed in. And gluten is going to be obviously a huge one, but we can also use nutrients like lemon balm or Melissa officinalis. We can use lithium orotate. We can use carnitine. We can use blue flag. We can use a lot of different herbs to help curtail it. But I strongly recommend that you get with a functional medicine doctor, and I strongly recommend you have your conventional endocrinologist monitor you just so you don't have a thyroid storm issue and have a stroke. So you really want to make sure you're monitoring that. Conventional medicine will typically, give you some thyroid and ablate give you some radioactive iodine and ablate your thyroid, or they'll just remove it. So that can be pretty drastic. I've had many people with Graves been able to keep their thyroid. So you really want to have someone monitor you so you don't have any thyroid storm issues and have a stroke. But if you do have time, try the natural thing so you can keep that thyroid if possible. A couple other questions here. How do you suggest treating TSI antibody that is high? 368, similar to Hashi's? Nope, I just addressed that when I talked about Monica's Grave issue, so just rewind that to listen to it. So I know I have thyroid problems, adrenal problems, and gut problems. Which do I treat first, the chicken or the egg? Great question. So the first thing I always do with my treatment modality is, number one, the diet has to be dialed in. Why? Because that provides nutrition, that provides anti-inflammatory support, and you're actually reducing toxicity when you have a good, healthy diet. So kind of a paleo or an autoimmune paleo template, eating every 4 to 5 hours, that's essential. And then really making sure we can even break down or digest those foods. A lot of people, if they can't digest it and break it down, food can actually become more of a stressor. So we want to make sure that we can digest it. HCl and enzymes is a good first step. Again, seeing a functional medicine doctor is going to be much better for you, because like someone like myself, I've treated thousands of these cases. So it's old hat for me. It's like, you go up to Nepal or, over there in I think the upper northern part of India there where Mount Everest is, you hire a Sherpa to go to the top of Everest. Why? Because they've been there dozens of times, and you'd be foolish to go walk that journey on your own. You may get lost, right? So again, with yourself, it's always better having someone that's like a Sherpa, so to speak, that can help you get to the top because they've been there many times before. And I actually have I've had a thyroid issue myself, so I'm very familiar and I can empathize with anyone that has it. And I have a book coming out called The Thyroid Reset, tentatively, very soon. Let me pop over to my Facebook peeps and see if they have any questions here. Shelly wants to know, how can my thyroid antibodies be out of control? My thyroid panel is normal. Very frustrating. Well, it really depends. How high are your antibodies? Let's say the LabCorp range for TPO, for instance, is greater than 33. The LabCorp reference range for thyroglobulin antibodies is greater than 1. So if it's just a little bit above, less stress, less immune attack, your body may be able to adapt to it. Maybe you're doing a lot of things regarding your diet and inflammation and supplementation to keep the stress down. I'm not sure what you're doing, and I'm not sure what your levels are, but the healthier you are and the lower your antibodies are, the greater chance you have to adapt to what's going on. The higher the antibodies, the more attack. That's where you're going to have a lot more stress, because you'll be killing off a lot of those thyroid follicles and have less hormone ability to regenerate. And that's where you start running low. See here, TSH was 113. You got to get that looked at. Probably some autoimmunity for sure. See here, Agnes says, I had a pituitary tumor, 2 brain surgeries, and radiation. Any advice? Oof, that's tough. So number one, I would get to the root cause of what caused the tumors and cancer issues to begin with. That's number one. And number two, I would do your best to recover. Chemo and the radiation can create lots of damage. So I would really be getting nutrition on board, antioxidants, lots of healthy fats, lots of detoxification support to help pull out any of the chemos. My biggest concern is chemo brain, where you just have a lot of that chemo still trapped in your body. And again, I'm not sure. You didn't say you had chemo, but I'm guessing that you may have it. So the chemo brain issues there, and just really getting all of the nutrients back on board and fixing why you had the cancer to begin with. That's going to be huge. Let's see here. Any other questions for me? Let me go back to YouTube here. You're welcome, Monica. Yeah, so IRA. So I think you mentioned that's a iodine radioactive ablation in 2013. So of course, if that's the case, then you really got to do your best to now supplement with bioidentical thyroid hormone to get your levels back up to where they need to go. Do you run a GI map on all autoimmune thyroid patients? Absolutely. Again, we see lots of infections can drive thyroid issues, including H. pylori, including bacterial overgrowth like Klebsiella and Citrobacter, also parasites like Yersinia, Blasto, Giardia, Entamoeba histolytica. So infections can definitely drive it. Of course, infections can drive dysbiosis, which that can affect the enzyme sulfatase, which is important for T4 to T3 conversion. Again, the more gut stress, the more nutrient deficiency, the more lack of, let's say, a liver or detoxification nutrients that are present to run our cytochrome P450 oxidase pathways. We need B vitamins, we need sulfur amino acids, we need all kinds of really good nutrients to help run those pathways. And T4 to T3 conversion is highly dependent upon that 5-deiodinase enzyme, which is primarily produced by the liver. So Annie talks about her TSH is at 55. See here, she's at Lyme and Hashimoto's, was told to have to be on thyroid hormone for the rest of my life. Is there a chance I can get completely off my healthy thyroid, begin to function? Yeah, I mean, you could get off your thyroid hormone. It depends. You don't ever want to get off of your thyroid hormone just for the sake of getting off it. You want to actually fix the infections. And again, Lyme or Borrelia burgdorferi or the co-infections like Ehrlichia, Babesia, Bartonella, these can also be issues there as well. So you really want to get to the root cause. So you want to fix the diet, you want to fix the digestion, you want to fix the leaky gut, you want to get rid of the infections, you want to support the thyroid hormonally based on what it needs. And then as you get better and as you heal and as the other underlying body systems get better, you may be able to slowly decrease that bioidentical thyroid support. And I say bioidentical because you want not just the T4, you want the T3 in a NDT kind of non-desiccated or a desiccated thyroid glandular. You're going to get T4, T3, T2, T1, T0. You're going to get these protomorphogenic compounds, and you're going to get a lot more hormonal support from a full spectrum glandular than you will from, like, let's say Synthroid or Levoxyl or Levothyroid. So I always recommend the full spectrum if you need it. Get everything stabilized first. What's the safest detox for a son who's 15? Well, the first safest detox is just stop putting in toxins. So if your son's eating a whole bunch of crappy foods, that's the first place to go. 2, you could increase the water. 3, you can do a little sauna session. And then 4, maybe add in, make sure they're eating healthy meats and proteins and they can digest it. And then maybe add in some green juice, obviously low sugar. That'll give extra sulfur sulfur support for detoxification too. Is it common to have hypothyroid for a male in the mid-20s? How long to heal if all parasites and adrenals and good diet are dialed in with your thyroid balance replete? Again, yeah, I mean, I had Hashimoto's in my mid-20s as well. Again, it really just depends on how symptomatic you are, like how good or bad a shape that you're in. If you're in decent shape, but you found it present, maybe with antibodies or other issues, yeah, I mean, typically 6 months to a year, you can reverse this stuff. Again, we always start with the foundation, which is diet, lifestyle, blood sugar, digestion. We work on the hormones second, right? whether it's thyroid, adrenal, female or male. That's important to regulate inflammation and energy. We work on the gut and the infection third or second. And then third, we work on detox and any other nutrients we see. How to lower reverse T3. We lower reverse T3 by supporting and addressing adrenal stress, number one. Number two, we increase selenium reserves. And then number three, we can increase liver support because we can actually start clearing out reverse T3 better with more liver support like milk thistle. But if the body's making reverse T3 for a reason, that may be symptomatic, right? So we actually have to get to the underlying stressors that are causing the reverse T3 to go high, right? The body's basically saying, hey, it's hitting that metaphorical brake on your engine to slow you down because it knows there's some underlying stress present and it's really trying to curtail it for you. So it's kind of like a fail-safe or, a governor on that car that's going way too fast. So Steve writes, desiccated, thyroid is taken twice a day. Some losing too much weight since on it. What's your opinion on daily versus BID, your experienced patients? I like BID just because of the fact that if you're taking full spectrum thyroid, you're getting T3, and T3 has got a much shorter half-life than T4. T4 can be anywhere like a day to like 4 or 5 days. So if you're conventional medical doc and you're recommending Synthroid, you're almost always recommending it because once a day is because the half-life's so slow or so low, right? So it doesn't make sense to take it twice a day or 3 times a day. But when we're dealing with a full spectrum glandular, we're getting T3, and the half-life of T3 can be anywhere between 3 hours to a day. So taking it, let's say at 7 o'clock when you wake up, waiting a half hour, then eating, and then maybe you do that again sometime between 11 and 1 o'clock. I think it does a lot better. And I would say if you're losing weight, I would say as long as your temperatures aren't going above, let's say 98.6 or 98.8, you can use an armpit axillary or a oral temperature test for that. And as long as things like excessive sweating, heart palpitation, anxiety, and those things are under control, then I'm okay with it. But worst case, we can always just run your T4 and your T3 and your TSH and see where the levels are at and make sure it's not going too high. That's always a fail-safe. We have subjective indicators, right? All those symptoms I mentioned. We have objective indicators, right? Like temperature. And then we have even more objective, which would be lab testing to know for sure. Let's see here. Welcome, Monica. Is there anything that can be done about autoimmune mediated dry eyes? I have ridiculously bad dry eyes, but not Sjogren's related antibodies. Okay, good. So there's probably some cortisol imbalances. Low cortisol can drive dry eye. So I would look at getting to the root cause of what's happening with your adrenals and your cortisol levels. You may need to add, if you're going low carb and you've been low carb or kind of ketogenic for a while, and the dry eyes are present, and then there's probably some cortisol issues. So get the adrenals fixed. Get your carbohydrates dialed in. Again, if you've been low carb for a while, gently start upping the carbs a bit at night. Choose safe, starchy, autoimmune approved kind of carbs, sweet potato, squash. You can even just do a little bit of honey, teaspoon of honey, tablespoon of coconut oil before bed. Sometimes upping the carbs a bit can really make a huge difference. All right, let's see here. Any other questions? Hey, you're welcome, Steve. Anything else, let me know. Let's see, did we get everything dialed in here? I think we answered almost everything. Let me check. So summarizing everything here, there's 3 ways that we assess thyroid function. Number 1, how do you feel? Do a lot of your low thyroid symptoms get better? That's number 1. That could be hair loss. That could be mood, constipation, anxiety. Heart palpitations can be high symptoms. Anxiety can also be high or low. Energy, right? These are going to be things, if we see that improve, that's a good check in the plus column. Number 2, we can monitor our thyroid function via temperature testing. So we like 97.8 to 98.2 for axillary temperature, right? 97.8 to 98.2. We like 98.2 to 98.6 or 98.8 for oral temperature. And we can kind of take our temperature once a day and kind of see where you're at with things. And that can be very helpful, that we can kind of just mark it out and see how your temps kind of go across the day. But if temps go too low, right below that 97.8 continuously, that may be a thyroid issue. If your temps are oscillating a lot, do a temperature, day to day. If you're having a lot of temp issues, going, let's say greater than 0.3 degrees Fahrenheit, there may be an adrenal issue going on there. So cortisol and adrenals are intimately connected. Cortisol helps the thyroid hormone get into the cell, right? We can have what's called T3 pooling because of low cortisol issues. So we really want to make sure that is supported and dialed in. Monica, desiccated liver pills. Would you recommend it? I mean, liver pills are going to be great, especially if you're a female that maybe has hormonal issues, you're having excessive menstruation, you're lower in iron, or maybe has some B12 issues. I think it can be great. With guys, I'd be careful daily with it just because guys tend to be more on the side of iron overload, which can create oxidative stress. So you just got to keep that in mind, be careful with it. But as a female, I have absolutely no problem with it. I think you're good. See here. Kelly writes, seeing a functional medicine doc with 40-pound weight gain, massive hair loss, low armpit temps. I have addressed cortisol and gut. Doctor still not wanting to treat thyroid. TSH 0.7, T3 2.3, T4 1.0. Yep, you definitely need your thyroid treated. Typical reference range is like 2.2 to 4 or 2 to 4 on the T3 side. And again, I think you mentioned T3 free is 2.3. You definitely need some thyroid support for sure. So definitely get that looked at. If you need help, let me know. Massimo, thank you so much for the congrats on the baby. Let's see here, guys. Anything else so far? So I talked about the 3 subjective indicator, or see, 1 subjective and 2 objective, right? 1 are the symptoms: hair loss, mood, constipation, hair, eyebrow stuff, mood stuff, right? Kind of make checks on that column on it. And I did a nice video a couple years ago on thyroid and adrenal symptoms. So go look up that video. Number 2 is the temperatures, how we're doing with the temps, right? Take 2 a day, just kind of see where you're at. Some people, they really warm up after they, get up and it's lunchtime, but, do it when you're still in bed. Don't get up. Don't take the covers off. Don't move around. Sit in bed still. Pull the thermometer, the fertility-based digital thermometer off your night table, and then just put it right in your mouth and get that reading. And then number 3 is going to be getting the blood test done, right? A TSH, a T4 free total, T3 free total antibodies. Or if you're just monitoring, typically T4 free, T3 free TSH is enough. Is it possible to gain too much muscle and lose fat at the same time? Typically not. It's in the bodybuilding world, it's really difficult to gain muscle and lose a whole bunch of fat at the same time. You can gain muscle and lose fat, but if you're trying to optimally gain muscle, typically you need a little bit more on the carb side, which can drive a little bit of weight gain. But if you're trying the best of both worlds, you can, but it just won't be optimal on the muscle side. But unless you're a bodybuilder, who cares, right? Kill 2 birds with 1 stone. Is there a correlation with thyroid problems and male pattern baldness? I imagine there is with men, because thyroid hormone is important for healthy hair follicle growth and stimulation. So lots of people who have thyroid issues, and we resolve the thyroid issues, hair loss improves. Also got to look at the gut, because if there's issues in the gut where you're not absorbing and breaking down proteins and amino acids and fat properly, you're not going to have good building blocks for your hair anyway. So yes, definitely getting thyroid fixed as well as the gut can help. What diet is best to help my nephew? He's 22 and schizophrenia. So if you look at Emily Dean's work, she's a paleo psychiatrist. She's talked a lot about gluten and schizophrenia. So I'd get him on a autoimmune paleo diet, and I'd work on blood sugar stability, eating every 4 to 5 hours, healthy proteins and fats, and make sure he's digesting his foods, regular BMs, not too much black gas and bloating. And if that's a good starting point, and then outside of that, get him connected with a really good functional medicine, a doctor. That's going to be super helpful. All right, guys. Again, today's Labor Day Monday. I hope you enjoyed this Q&A here. I'm going to go spend a little bit of family time. Hopefully you enjoyed everything. Oh, let me get Monica's last question here. Why indirect bilirubin's 1.08? Any ideas? Total is 1.38. Direct is 0.3. Just a little bit positive. Hard to say. It could be a little bit of liver / gallbladder stress going on. I wouldn't worry too much about it. Worst case, you add a little bit of liver support in there. Just make sure everything's going good with the foods. You're not adding too many toxins in there. Just keep an eye on it. That's not too high at all, just a little bit above. Keep an eye on it, and we can chat later. You guys have an awesome Labor Day, and you guys just enjoy your day, and I'll be back later on this week. Thanks a lot. Appreciate it. Bye now.